Grant Review Committee meeting. My name is Casey Beck. I'm CJC's Behavioral Health Program Manager. And before we jump in, just a reminder that this is indeed a public meeting and it is being recorded. The chat feature has been turned off. Please direct all questions to co-chairs and staff. But without further ado, we will move along. So today's anticipated meeting schedule is shown here. Note that, of course, all times are just general estimates, but we're planning on pausing for public comment and then moving on to the only action item of the day, which is to review an adjustment request from a grantee related to impacts. And then we have our friends from OHSU PSU School of Public Health. Sarah Rayner will be joining us to provide an overview of the impacts qualitative findings report that they recently published. And then maybe about an hour in, depending on how things roll out, we'll be switching over to talk about future solicitation and future impacts and all that jazz. Looking forward to it. But before we get in, since we'll be pausing for public comment and going right into an action item, I was hoping that Avery, you could take roll, please.
Absolutely. Just 1 second. All right. Co-chair Sam Byers.
Present.
Co-chair Ryan Keck.
Present. Good afternoon, everybody.
Judge Suzanne Shanti.
Present.
Jeremiah Stromberg. Liz Weber.
Present.
Steve Gunnels.
Present.
Eric Swallow. Chief Marsha Harnden let me know she will not be able to attend. Commissioner Claire Hall. Alicia Beamer.
Present.
Stacey Brubaker.
Present.
Dr. Greg Brigham.
Present.
Sheriff Nick Hunter.
Present.
Dr. Sharon Stanfill.
Present.
Senator Gelser Bluen. Janie Gullickson.
I'm here and able to be here until 4. Thank you.
RJ Navarro. Michelle Mason. Representative Choatin.
Present.
Paul Solomon. Oh, he also let me know that he would not be able to attend. Carl McPherson. Okay, I believe, Casey, that we have quorum exactly.
Okay, thank you for that confirmation, Avery. We will pause for public comment, but GRC members, because we only have quorum exactly, if anyone needs to depart or step away for that action item, please let us know. We've got to make sure we have quorum to take a vote, so that would be appreciated. But yes, we'll pause here for public comment. Are there any members of the public who wish to make public comment? Now would be the time to do so. You can unmute yourself, raise your hand. If you're on the phone joining us, feel free to unmute yourself there. We have, about 5 minutes for public comment, but if there's no one who wishes to provide comment, we'll move on. I'll pause now. All right, I'm not seeing anyone raise hands or unmute, so I think it will be okay if we go ahead and move forward. Okay, so every quarter's grantees have an opportunity to request an adjustment request as part of quarterly reporting. The most recent quarterly reporting closed on July 25th, and we received one request from Clackamas County's Impacts Program that meets the threshold for your review. I wanted to provide some high-level details and then turn it over to you all for a vote. But first, thought it might be helpful, especially for anyone new joining us, to give a quick refresher on the budget adjustment request process. So grant review committee approval is needed when any request movement exceeds 10% of that grantee's total grant award, or when a new program is created or an existing program is altered significantly. We call that like a substantive programmatic change. Otherwise, staff are authorized to process any other adjustment requests, and we also implement a voice voting process because there are so many of you. Staff will be sure to articulate the matter that is up for vote. There's no need for motions. If there are any abstentions, those who choose to abstain from a particular vote may do so. Just need to announce their abstention before the ayes are taken. Yes and ayes, those in favor will say aye or yes when prompted, and then noes and nays, those opposed will say nay or no when prompted. Right, so Clackamas County's impact adjustment request is before you today because it exceeded 10% of their total award amount. There's nothing else substantially programmatic changing, about this request. What really is happening here is they have significant vacancy savings from a peer support services position that ideally would have come through a partnership that they had with Clackamas County Behavioral Health. But unfortunately, the positions just remained unfilled for this grant cycle, not to the efforts of course, any of the entities involved. That Clackamas County mentioned that while Clackamas County Behavioral Health was unable to fill the position, they totally recognize the value and significance of peer support. It's just, unfortunately, this contractual position was not filled. So that being said, they had quite a bit of vacancy savings, $107,374.55 to be exact. And they are requesting to reallocate, significant portions of that to 4 different categories. The first being $100,000 to housing assistance. Clackamas County noted that their impacts clients especially have faced increased housing insecurity. And of course, that always is a barrier to any sort of engagement. They want to redirect these funds to cover emergency rental assistance, motel stays, transitional housing, and of course, complemented with supportive case management. So they have a total request from the contractual services line item, $100,000 to housing assistance. There's a little over $3,100 being requested to transfer to the other category, and that's going to direct client support, including transportation assistance, clothing, and phone services, just items needed for client engagement. And the next line item here is a little over $1,400 to supplies, and those are going to what they classify as essential program and client materials. And then last but not least, a little over $2,700 going to the administrative and indirect costs category, covering it, admin expenses, such as fiscal oversight, grant reporting, program management, etc. So are there any questions about this request from Clackamas County's impacts program? Okay, I'm seeing none. Oh, sorry, Judge Shanti, I jumped the gun there.
Yeah,
please.
I was just wondering, and maybe even Jenny could chime in. I just don't understand, and I'm not blaming anyone at all. I just wonder, how could it be that there couldn't be a peer support person found in Clackamas County? That just mystifies me.
Thank you for your question, Judge Shanti. I do not have an answer for you. Janie, sorry, saw you pop off mute there if you had anything you wanted to weigh in.
I mean, the same question crossed my mind. I did hear, though, it was a community org that would have been a subcontractor on this project with Clackamas Behavioral Health, and I don't know who that is. Yeah, I could not guess why the position couldn't be filled.
Well, so that, I mean, obviously we need to vote on this, and I'm not trying to hold it up, but I'm wondering what staff can do, you know, to explore with Clackamas County why that didn't work. Primarily because at least the research I've read, and we have people on the phone that know better than me, but the research I've read is that peer support is really integral to getting people to show up, you know, to engage, all of that. And so it's troublesome to me if it's a subcontractor didn't do what they're supposed to do, or someone dropped the ball, then they need to figure out who to do it with next time. Or if there was no fault, what are the strategies to try to build up? Because I thought their idea of having peer support was great. Again, I'm not trying to hold up the vote. I'm just wondering if staff can work with them, or we can get maybe we're going to be gone, but you know, just if something can be done to help them achieve that, or maybe it's turned out that peer support's not as helpful as I thought.
Sam, I see your hands up next, then Stacy Brubaker, then back to Janie.
Thanks. Just a clarifying question. Is it that they were unsuccessful in having an agency to contract with them for peers, or were they attempting to hire a peer in-house? I know that there are sometimes struggles with that versus contracting out, and I apologize if I missed that detail. And agree, I don't want to hold up the vote, but I would be curious about that.
Yeah, I have the amendment request as it was provided to all GRC members. That's the information that the agency is working off of. They noted that the position remains unfilled, and that they were contracting with Clackamas County Behavioral Health to fill that position. So that's the information that we have regarding this. Stacy Brubaker, I know that your comments next.
Thanks. So what I would just say to Judge Shantae's comment really is that, you know, even in the peer space, there is a workforce challenge there. And so, you know, I work for Jackson County, and we certainly have the similar issue of having positions that are posted, including our peer positions, that are really hard to fill sometimes. And so they do sit vacant for quite a long time. I can't speak to like what recruitment efforts or incentives they might have been offered, but just like any other behavioral health workforce category, peers also continue to be a struggle for us as well. And I don't believe that it's anything to do with a reflection around the work of peers. Peers are amazing, and they go in places where we can never go, and can relate to people in ways that none of us would ever be able to. And so I don't think it's an issue about whether it's a value or that they're impactful, because I do believe that's one of the most impactful folks on a team. But that workforce challenge continues to be real, even in the peer space.
Thank you, Stacy. I also see that Christopher Chandler is here with his hand raised from Clackamas County. Chris, I acknowledge your hand is raised. Typically, we try not to put grantees in the hot seat to answer these kinds of questions, but I wanted to recognize that your hand was raised, and if the co-chairs had other direction, we can move forward. But Janie, go ahead and share your comment.
Thank you. I just did not want to leave us with potentially a last thought being that peer support was not effective when utilized in scope without being asked to do things outside of scope. Peer support is as vital a part of the team as all team members, and there is some magic in it, and also agreed with the workforce challenges. I would say, though, our experience at MHAO is that we are getting plenty of candidates to varying degrees of qualified, so that could be an issue too, as well as, you know, competition is, we're all trying to hire, and that could be a challenge as well if pay and benefits are not sort of similar. So those could be some of those issues as well.
Thank you, Janie. I guess bringing back to the issue at hand, though, the project period for this impacts grant ends December 31st of 2025. And Clackamas County, has brought this request before us today because the position remains unfilled. And I am nearly positive, even if they were to try getting that position filled between now and the end of this year, getting someone onboarded, it's a lot of effort. And I don't know if they'd be able to spend down the money as presented. So with their request being to move the funds and reallocate, are there any other questions or comments about the request here as presented? Okay. Then in the interest of time, I think we should move forward with the voice vote. So the decision before you now is whether or not to approve the the adjustment request as presented here on the slide from Clackamas County. Are there any abstentions from this decision before we move forward? Okay, seeing and hearing none. So those in favor of approving the request from Clackamas County, please say aye.
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 Aye. Aye.
Thank you. And those who oppose, please say nay. All right, so the amendment request does pass. We'll let Clackamas County know, and we'll be sure to touch base with them per your request, Judge Shanti, just to gain a little bit more insight as to the whys and maybe some potential lessons learned for the next go around. Okay. Well, I'm actually now going to pass it off to Sarah Rayner with OHSU PSU School of Public Health. But I'm seeing Inga pop. Oh, there you are. Okay, sorry, Sarah, it lost you there. All right, I'm going to stop sharing and let you go ahead and take the driver's seat.
Great, thank you, Casey. I'm just going to get the slides set up. Casey, if you could let me know when they show up on your end, that would be great.
I can see them now.
Great. Okay, good afternoon, Impacts GRC members, and thank you for having us. I'm Sarah Rayner. I'm a research project manager at the OHSU PSU School of Public Health. I am here today with my colleague Inga, and we're going to present what we learned through qualitative interviews with the Impacts programs. Quick note that we'll have time at the end of the presentation for your questions and discussion. Our team interviewed all 15 Impacts grantees covering the 2022 to 2024 grant period. The interviews were conducted between October 22nd and November 20th of 2024. The interviews were transcribed, and then we analyzed them to identify cross-cutting themes among programs. Our team reviewed published research about programs with similar target populations and similar goals. And overall, Impacts grantees are using approaches and also noting experiences that mirror what we're seeing in the literature. To help frame today's presentation, I'm going to share 3 elements that we pulled from the literature that are of particular relevance to the Impacts program and to the qualitative interview findings. The first one is local flexibility. In the literature, some studies noted intentionally using flexible and very broad target population criteria, and that helped programs to increase their reach to program participants, as well as appropriately tailor interventions to individual circumstance and need. The next element is tribal-specific programming. which simply refers to the fact that tribal programs are well positioned to meet the needs of tribal members who are involved with criminal legal systems. In the literature, and well known that incarceration rates in our country are disproportionately higher for American Indian and Alaska Natives, particularly among young males. A recent study found that this group had higher rates of mental illness and substance use disorders, and that their justice involvement was significantly associated with higher use of emergency departments, hospital stays, as well as inpatient treatment. And the third element that we're going to use to frame our presentation today is changing systems of care. What this means is changing the systems around the individual and changing the systems in our community to better target the root causes that are driving high utilization behaviors. A few promising practices that we pulled from the literature that help to facilitate systems changes are cross-sector collaboration that provides wraparound services for this population, dedicating resources for data sharing infrastructure, as well as embedding behavioral health professionals in crisis response. At the close of the presentation, we're going to share a few challenges that grantees faced, as well as some key takeaways. And at this point, I'm going to pass it over to my colleague Inga, co-author of the report, to walk through how these areas that we pulled from the literature really tie into the impacts programs and the qualitative findings.
Yes, thank you, Sarah. So I will discuss the themes that we found across our interviews, and I'll start with that local flexibility and how these programs are developed and tailored to local needs. And I'll let you read the quotes yourselves. But impacts programs differ in their approach, which allows local need and resources to shape the programmatic design. Next, please. Impact staff build connections, rapport, and trust with program participants. For some programs, connection and trust building occurs before someone is more formally engaged with treatment or services. This pre-engagement work of building rapport often includes addressing basic needs like a phone, clothing, or food. Rapport building is important as patterns like repeated jail bookings or emergency department visits take time to shift and change. Next, please. On the theme of tribal-specific programming, we found that Impact's tribal programs are uniquely positioned to build rapport and increase engagement among tribal members. Tribal grantees emphasize that being tribal members or tribal service providers reduces the stigma that participants may have about seeking treatment or support. Being situated within tribal government settings is an inherent asset to quickly gaining the trust of participants. Next, please. Most tribal grantees described improved relationships with agencies like law enforcement, jails, courts, and county governments. However, some tribal grantees described systemic barriers such as jails not being incentivized to track tribal members in their census, which then required extra work on the part of the tribe to identify their members in custody. Next slide, please. So we would like to highlight some innovative examples of tribal-specific programs, such as one tribal grantee who accepts diversion referrals from counties to their tribal court system, primarily for small possession charges. This program is open to members of any federally recognized tribe and focuses on participants becoming culturally involved with the tribe and getting people re-engaged with their family. This is beneficial for the participants and has made local county government agencies much more aware of this impacts program and willing to reach out and work collaboratively with this tribe. Next, please. Another tribe partially funds an artist's workshop with their impacts funds, where anyone can come and practice the traditional crafts such as beading, carving, and drum making. But importantly for them, a person cannot be using substances while doing these activities in this tribe. They described this workshop as a place of healing, solace, and social connection for folks working on their sobriety. One person who had been to treatment multiple times credited the beading at the workshop with her healing. She now actually works for the Tribal Health Center. These practices ultimately help individuals reconnect with their culture and traditions and provide meaning and fulfillment, and help them be successful beyond the standard substance use disorder and mental health services. Next, please. So this figure shows how programs are working not just at the individual level, but influencing systems of care and change at the community level and even beyond the impacts population. This work is difficult to quantify and isn't really captured by regular reporting, but across sites we observed a similar cycle, beginning with this increased impacts awareness and participant success. Agencies like law enforcement started to notice when frequent callers and high utilizers no longer took up a lot of their time thanks to impacts. Next, please. This not only increased referrals to the impacts program, but also increased willingness of agencies like law enforcement to invite impact staff to collaborate and join meetings like a multidisciplinary team or MDT and local public safety coordinating councils, also known as LIPSICs. Next, please. Once agencies became involved with impacts programs, they could discuss better ways to identify potential participants or collaborate on outreach and treatment plans for specific individuals. Next, please. So finally, this close collaboration allowed agencies to adapt and align their services to avoid duplication or to fill specific community needs for a more efficient use of resources. Next, please. So continuing this theme, we observed that these efforts to change systems of care have resulted in effects felt beyond the impacts population. One way this worked is through reduced criminal legal system burden. For example, one program's case management efforts drastically reduced the rates of failure to appear in courts, which gained the trust of local judges. The local judges then began allowing more pretrial release, resulting in a notable decrease in the local jail census and a decrease in forced releases from the local jail. Several other programs partnered with jails or even co-located services within jails to facilitate discharge planning and support, including planning rides when a participant was released directly into treatment or to other services to prevent opportunities for slip-ups or recidivism. Next, please. Another example among impacts grantees is embedding behavioral health professionals in crisis response. At least one grantee receives behavioral health crisis calls directly at their facility. Another program was a key contributor in implementing a local 988 crisis line, and additional grantees have established a process to receive behavioral health specific call information from emergency services to inform outreach efforts. Next, please. Finally, dedicating resources for data sharing was a strategy used by some grantees for expanding their program reach. Multiple grantees, through either a collaboration with their CCO or use of certain software, have dedicated resources for data sharing. This provides real-time insight on health information exchange across agencies. Next, please. So despite these successes that we've heard about, a few challenges remain. Challenges raised by grantees include the lack of resources available for participants in the community, such as crisis, respite, and residential services, with a particular emphasis on the lack of housing available to impacts population. Grantees spoke about how the success of impacts programs really depends on robust partnerships, but grantees in communities with service gaps are much more limited in their reach. And often, rural programs spoke about the pressure to operate in multiple systems due to the lack of other community resources. Next, please. Almost half of grantees noted staff capacity issues, specifically frequent staff turnover and the inability to quickly rehire positions. Next, please. More than a third of grantees mentioned administrative barriers, including accessing certain data points across different systems. A lack of data access can limit meaningful data tracking for programs, and it can also affect program operations. For example, not having access to jail release information can lead to staff missing opportunities to meet participants upon release. Next slide, please. So in summary, here are the key takeaways from our findings. Impacts programs meet participants in moments of crisis and transition, filling critical gaps in community services. Impacts programs frequently engage with individuals who are between service providers or as they are moving from the criminal legal system to safe and stable housing. Without impacts, grantees noted that service gaps in their communities would not be filled or would be much more difficult to fill. Impacts often acts as a bridge, getting a participant from where they are to being engaged and ready for more intensive services. Next, please. Impacts provides holistic support extending beyond standard treatment or care, including reconnection with culture and traditions and family reunification. In addition to some of the programs we mentioned earlier, a number of programs spoke about their focus and success around family reunification and the implications for those kids now having stable homes and parents, especially for the kids that are removed from the child welfare system. Next, please. Grantees reported that the relationships with criminal legal systems have reduced rates of failure to appear in court, increased referrals to treatment, and improved reentry planning and support. Improvements to local systems of care have a positive impact on more than just the impacts population, affecting the larger legal involved population. So that's the end of our presentation today. I will now open it up for questions and discussions. Thank you all so much for your time.
Thanks so much, Sarah and Inga. Are there any questions from GRC members? Okay. I'm not seeing any at this time, but thank you so much for being here to share the qualitative findings and the report in its totality. Of course, it's up on our website on the impacts page, should anyone want to do a deep dive. There's a lot of value in that qualitative analysis, and I think there's some really rich information that can be learned from programs that data just does not capture. So I appreciate your efforts, and thank you so much for being here. All right. Before we pop back into the work that we have ahead of us today in terms of brainstorming, it came to my attention that Sheriff Hunter is here. You said you were present, and I didn't clock it, and I apologize. You are the newest GRC member, and I wanted to say hello and thank you for being here, and also give you an opportunity to say hi and introduce yourself if you'd like to.
Sure, happy to. Hello, everyone. My name is Nick Hunter. I'm the Marion County Sheriff. I think previously this spot was filled by Curtis Landers, and Curtis Landers retired. I have a lot of interest in this area. Many of you are aware of my LEAD programs. We don't have any impact-specific grants, but running LEAD, it mirrors tremendous amount of what all of this is and how this is implemented in the community. Listening to the feedback right there on those reports alone, a lot of those are what we are seeing in Marion County, right down to the part about trying to hire a peer support person. Man, I could engage in that discussion all day long. It sounds like such a simple task, but currently trying to find, and somebody said it and said it well, it's not just those that are applying, but finding that qualified person, that person that is that peer support member with lived experience, but the ability to use that lived experience in a positive way to positively impact our community and work through some of those situations. Not easy for everyone to do. So those can be actually very tricky positions to fill. So probably more than you wanted, Casey, but I'm excited to be here. I'm going to be part of the group. anyone has any direct questions or anything, feel free to reach out to me anytime.
Thank you so much. And again, warm welcome. Let me get my screen back up here. All right. So I wanted to acknowledge to Janie, I appreciate that you said you had a hard stop at 4 o'clock. There are no action items left on the agenda. This is just an opportunity to hear some input and brainstorm together. So that being said, I don't want you to miss out on that opportunity. And if things come to mind from you or any other grant review committee members, feel free to email me. I'm always available via email, or give me a call if ideas come up. We definitely want to solicit your input, and so your input matters, Janie. We don't want it to go unheard.
Thank you, Casey. And then I may take this opportunity to go ahead and jump off, since I'll be leaving town tomorrow. I'm actually on sabbatical, but did not want to miss this opportunity in this meeting. So thank you all, and see you next time.
Thanks, Janie. All right. Well, first and foremost, I have some legislative updates to share with you all, and then a quick discussion about kind of where this grant review committee is going, and the roles and responsibilities. I also have some news as part of the legislative updates about impacts funding. And then I'm hoping we can transition into kind of a listening session about the future impact solicitation, the next iteration of impacts, and talk about next steps. So first and foremost, here are those legislative updates. House Bill 3069, which passed this last session, made lots of changes to many of CJC's grant programs, both including impacts and the Behavioral Health Deflection Grant Program, BHD. Importantly, and I know I updated all GRC members over email about this in the interim, but wanted to acknowledge it for the record, that decision-making authority for the BHD grant was transitioned to the Oregon Criminal Justice Commission effective July 1st, 2025. So that is no longer under the roles and responsibilities of this GRC. And should you want to stay engaged and stay tuned to the developments of the BHD grant program, you may do so by tuning into our commission meetings. But for the benefit of this GRC, I wanted to let you all know that the next BHD iteration is underway. We currently have an application open for phase 1 of a 2-part phase funding scenario for this next biennium. And, we're expecting almost all the same players in terms of participation from previous grantees, and some exciting changes to come to BHD. And I thank you all for your efforts in getting that program up and running and out. That was not an easy lift, so I wanted to acknowledge that, and again, express some gratitude for all your work on that program. Notably, the decision-making authority for the Impacts Grant Program will move to the Criminal Justice Commission effective next July, so July 1st, 2026. Until July of next year, Impacts remains under the decision-making authority for this group, for this grant review committee. And we have work to do. So I hope that you are excited to stay engaged and again kind of usher this new iteration of impacts out the door before kind of passing the baton to the commission. But yes, as of July 1st, 2026, the GRC will not be in operation any longer. And really, that's because both Impacts and BHD are kind of becoming part of a new consolidated mega grant that we're calling the Oregon's Public Safety Coordination Grant Program, which will be effective next biennium, July 1st, 2027. And they're not the only grant programs that are kind of being consolidated. As I mentioned, House Bill 3069 did a big reorganization of the way CJC is going to be doing business with counties in particular. Tribal processes are still going to be separate and really taken into consideration the needs and desires of the tribes through consultation. So what I'm talking about here is specifically for county applications, but yeah, it's going to be a different way of doing business, and impacts is going to be part of that. But with that came great news. Oh, yes, sorry, Dr. Stanfield, I will go ahead and pause here in case you have a question.
Thank you. Appreciate that. So share with me, the Oregon Criminal Justice Commission, do they have tribal representation on that commission? Do you know?
Yes, we have Commissioner Norton. Ryan, did you have any? I saw you were going to pop off mute there.
Take it away. You got the answer.
Yeah, so Commissioner Lisa Norton has a tribal membership and has been a commissioner for a while now, but is very active, and just saw her yesterday with part of the commission meeting.
Great.
So
Great, thank you.
So the exciting news is really that as part of the agency budget bill, House Bill 5005, the legislature appropriated additional funding, well, I guess, to BHD, so that you all are aware. So that's why the program's continue going. But for impacts and the interest of this GRC, there is additional funding available for use in the 25-27 biennium. That combined with the unallocated remaining funds totals $13,371,000 that is available. Also, and personally, I think this is the most exciting fact, is that impacts is now intended to be appropriated continuously moving forward. So it's no longer this one-time event that will be, struggled with advocacy at the legislature. It's been recognized as part of our agency's current service level. And while that doesn't guarantee funding every single biennium moving forward, because of course, the economic landscape of Oregon changes every year, if not every month, that is the most promising spot it could be in, which is the spot that many of our other large grant programs like the Justice Reinvestment Program, for instance, have with the CJC. So that is really exciting news, and is honestly the best segue into what's next. So you might remember about a year ago, for those of you that were present on the GRC, a decision was made to move forward with a performance-based approach, some sort of evaluation for the existing impacts grantees. And since that time, this GRC has been busy. Obviously, you were responsible for a much heavier workload than ever anticipated with the rollout and implementation of the deflection grant program. We also navigated a lot of uncertainty with the future of impacts and future funding for impacts. So all that to say, we have not forgotten about that conversation. And I really would like to pick it back up where we left off, with hopes to get some insight and input from you all as the subject matter experts for impacts, as the CJC prepares to build and create the next solicitation for impacts, specifically for the 2025-2027 biennium. So with that being our next endeavor, I wanted to lay a bit of foundation to kind of bring everyone back to setting the stage, if you will, of what applications have kind of included to date, what criteria, priorities, etc. And then, talk about kind of some of the parameters we have before giving you some ideas, and then really turning it over to you all in terms of the listening session to hear what considerations you have and things that you might like to see as part of the next solicitation, which my team will craft and build and then bring back to you all later this year. So for some foundation, to date, applications have included, of course, a program proposal, proposed budget, letters of support, commitment, report of input from local tribal governments within a jurisdiction, the firms of consultation, and then also a process or a plan for a process for tribal notification. There's the agreement to screen all eligible applicants for medical assistance and then aid in applying for that medical assistance if needed. And then county applications submitted by the LIPSIC, tribal applications submitted by the tribal governments. If it's a consortium, you kind of have your pick of, if it's LIPSIC or tribal government. But that being said, there are some specific criteria laid out in Oregon administrative rules and statute that Impacts has been operating in for the past grant cycles. In terms of the grant application review criteria, this is laid out in Oregon administrative rules. And for the purpose of putting this on a slide, I took the liberty of, shortening these up quite a bit. So if you want all the details, know that they're published OARs, but for the specific review criteria that this grant review committee would use to evaluate each grant application, that would be application completeness, then a program narrative and local system assessments, such as responsiveness to the impacts program priorities, the method for identifying and serving members of the impacts target population, an explanation as to how program supports and services kind of fit into a jurisdiction's existing infrastructure, of course, without supplanting any funds, a sustainability narrative, and any other criteria included by this GRC in the request for grant proposals. So thinking about this as kind of that foundation, there's some areas where I think we can get your input for this next iteration of the solicitation. And that is that responsiveness to impacts program priorities. Like, what does it mean to be responsive to, adhering to the program's statutory purposes? Obviously, reducing the number of jail bookings and reliance on emergency departments and the Oregon State Hospital. So what does it mean to be responsive to that? What does it mean to strategically leverage that grant funding and support it kind of infusing extra treatment and services into an existing jurisdiction's infrastructure. And then any other criteria included by the GRC in the RFGP, the request for grant proposals, the solicitation, if you will. We got a lot of names for those things at the state. So thanks for keeping up with me. And if you have questions, let me know. But this is kind of the stage that we are about to step on. And we have, some parameters to operate within. Going through rule changes would be a lift. So I don't think we have the time to do that ahead of the next grant cycle, but there's some opportunity to be creative and also be responsive to what we've learned and what we want to do moving forward. That being said, I want to also bring your attention to a couple of things. First and foremost, the existing project period for the 15 grantees that we have going on right now ends on December 31st of this year. The next solicitation is going to be a blank slate. So everyone is going to be applying anew. That is the first time that's happened because we have continued contracts and with extensions, over the past several years. And so this will be a true closeout of contract for this cycle and a new application for new contracting for the next biennium. Obviously, we will need to enter into tribal consultation to learn the needs, the desires, and kind of the available services for tribes and how to move forward with a tribal solicitation. In the past, tribal solicitations have been separate from county solicitations, excuse me, to be as responsive as possible to the tribes and their specific needs. So entering into tribal consultation, I expect that we're going to learn a lot about how to inform that solicitation creation. And so focusing today mostly on the county solicitation is kind of the space that we're operating in. I want to flag that it's very likely we should expect returning grantees. So folks that want to continue their programs beyond December 31st of 2025, as well as brand new applicants. Over the years, there have been, counties and jurisdictions who have reached out, tribes as well, but focusing on the counties who have reached out and expressed interest in starting up an impacts program. And with a clean blank slate new solicitation, now would be the time to do so. Impacts is also competitive. You saw earlier, we have, limited grant funds available. It's not, a pocket without a bottom, unfortunately. And so we will need to encourage folks to leverage that grant funding strategically, as is required by statute, and also take that into consideration of the competitiveness and maybe think about how we apply preferences, priorities, and criteria when thinking about the next phase of the impact solicitation. And then, of course, we must operate within existing Oregon administrative rules and statute. So this is the last slide I have before kind of handing it over to you all. But for your consideration, I wanted to introduce kind of a number of concepts here for potential discussion on brainstorming, prioritization, and the list is not limited to this on the slide. Just thought this would be a good place to start conversation. The goal here, the ultimate goal, is to capture what this GRC thinks is important. What legacy are you all going to impart on the impacts program as these subject matter experts that have been with this grant program from start until now? So that's the kind of substantive information that myself and my colleagues are looking for today. And as I mentioned, we're planning to, go to the drawing board after this and, take your input, your thoughts, and your ideas and try to clobber something together and then bring that back to you all later this year. But something I want you to think about as you soak up this information is what things have we seen over the past impacts grant cycles that you think might be worth prioritizing or even rewarding as part of future applications. Things like, what do programs provide? How much do they provide it? Are there certain merits as to how something fits into an existing local infrastructure? So on this slide, you'll see that we've identified a number of areas in which we're seeking that input from you all about prioritization. And they're kind of broken out into 6 boxes. We can discuss any of these in more detail. And my colleague and the senior researcher on the Impacts Grant, William Ashhoughton, is here and present with us. Should we have any technical questions or if there are other things that come up comment-wise that we are start brainstorming, he is here and present, and we are also both going to be taking notes like crazy to attempt to capture your ideas. But I wanted to kind of walk you through these, and then I'll open it up to you all for questions, and we can start kind of like this listening session portion. So starting at the top left there, past spending patterns might be a consideration. And the reason there's an asterisk there is because obviously a new applicant wouldn't have impacts past spending patterns, but a returning applicant would. Someone who was a grantee beforehand, might that be something you want to consider as to what their spending track record was like? Were they awarded an amount and they, spent that money at the level that was expected? Or alternatively, did they really maybe ask for too much the first time around? And are we seeing something a little bit more responsive to their needs this time around? Is that something you want to consider? Program models, the next one down. We've encountered a number of these throughout the life of impacts, and figuring out, where different programs are operating has been fascinating, and also really speaks to the flexibility of the impacts grant. We have seen programs housed in behavioral health. We've seen programs housed in law enforcement and tribal organizations as well. And how do these speak to each other? We've seen programs that have really prioritized intensive case management or specifically just housing and sheltering. We've seen programs prioritize sobering and stabilization centers, street outreach, kind of like that one-on-one connection with folks. There are different ways of implementing impacts. We've seen many of them, potentially even 15 different versions. And all of them have their merits, but is that something you want to consider? Or at least at minimum, is that something that you want staff to be able to analyze and bring to you when these applications come through? Is it something that we want applicants to classify themselves as in, hey, we operate in these certain ways, so that maybe we can group these folks together for consideration? Next up is target population on the bottom left down there. So in terms of target population definitions, many programs held the 4 or more arrests lists for some time after their programs were already implemented, and the behavioral health condition. Other programs, really needed to adapt and change their definition to what a high utilizer was defined in their local jurisdiction. So, are there any priorities there? Is there a minimum we want to identify? That is something that we want to, gather your input on as part of the solicitation. Next up, treatment and service provision. So in terms of treatment, and what happens exactly, what these folks get connected to as part of their impacts programs, core services might include case management, care coordination, peer assistance, housing, mental health services, substance use disorder services. This kind of loops back to the earlier statement of what are programs providing? How much are they providing it? Who's involved? Is there a certain number or percentage of participants that we want to see actually being connected to services? The quantity of available services available to a population. So those are some things to consider. And then outcomes. What should we be tracking in terms of outcomes? We are lucky to have this amazing REDCap database that programs report to on a monthly basis. And we're tracking a number of outputs, if you will, of things that are happening with programs every month. But overall, kind of thinking back to those program priorities, are we looking for just reductions in arrests, cases filed, et cetera, uses of the emergency department or admissions to the Oregon State Hospital? Or, as Sarah spoke earlier in kind of that qualitative findings report, there are other things outside of just that data collection that might be important to consider in terms of outcomes. You think about stabilization centers and the outcome of potentially saving a life. How do we quantify that, and how do we measure that? And is that something that we want to consider, in terms of how impacts functions and what we want to see of a successful impacts program? Other things that, really could be included and be measurable might be improvements to the social determinants of health, and reductions in just general encounters, or maybe increases in encounters in terms of encounters with service engagement and treatment, general diversions, etc. And then, of course, there's a big ol' other box there included as well, because this list is not exhaustive. So I've been speaking for at least a couple minutes, and I think it's time that I turn it over to you all. I thought it might be helpful to leave this slide up a little bit so that you can kind of soak it up and take it in, but if it gets distracting, I'm happy to take it down as well. But turning it over to the GRC, what are some thoughts, ideas, as you're thinking about the next iteration of impacts, the next solicitation, everyone applying anew? What do you think is important? And we'll take whatever we can from you all in terms of input, knowing that maybe some of it is feasible, maybe some of it's not. But we will try to, again, take what you're saying today and put it into a solicitation that's responsive to that, so that you all feel heard and can impart that legacy. Dr. Brigham, I would love to start with you, please.
Thank you. So thanks for that summary too. It was good to talk through those categories. So what I would suggest is not novel or even new in the program. When I think of impacts, I always think of Malcolm Gladwell's $1 Million Murray. And, just this notion that you can have these individuals with frequent encounters with law enforcement or other public services, poor social supports, addiction. And so you end up with, in that case, $1 million of preventable medical costs that were not prevented because the systems weren't in place. And so to me, impacts, one of the key sort of things to it is this high involvement with criminal justice, high risk involvement with criminal justice, and high preventable medical costs. And, in a variety of ways that those high preventable costs can show themselves. And to me, that's sort of the thread that would run through the whole thing. So that's the target population. Those are people where there's enough variance in the outcome variable to show that you're making a difference. And of course, it's not just showing the outcome. I mean, this is changing people's lives, improving the community and so on, but there's high potential impact there with a reasonably low amount of spend. So I think looking at projects that pull multiple entities within the community together, like law enforcement and the courts and mental health and the hospitals and substance use disorder treatment and, all those entities that can touch these individuals and make a difference. And not necessarily creating those things, but sort of creating a connection between them, filling the gaps, but also, ending up with something greater than just the small investment you put in by having a system that's, truly enhanced, whatever that looks like. I mean, in the project I was involved with, it was intensive case management and peer stuff and building out some infrastructure that was lacking for some of that very early engagement stuff. So I think it's different things in different communities. And then I think the target population characteristics flow very naturally into what outcomes I think should be looking for, which are preventing those high costs, reducing the number of arrests. So, the impact on the criminal justice system, but also numbers of hospitalizations and other high spend, preventable medical costs, while sort of filtering out that you might have higher costs for treatment and mental health services and things that are actually going to change the trajectory. So I think you want to look at those costs differently. And then, in terms of outcomes, I would think, prioritizing those. So like primary outcomes to me are the characteristics of the population, reducing criminal justice involvement, reducing, medical costs. And then secondary outcomes are the things you were mentioning, Casey, about, social determinants of health related stuff, just improvement in quality of life and stability in housing and all those other things that are sort of predictive of stability into the future. That's my 2 cents.
Thank you for sharing that. So what I'm hearing, is kind of a multidisciplinary collaborative approach, multiple partners, and a program that really considers maybe eliminating the gaps between the silos of existing infrastructure, and really law enforcement, behavioral health, et cetera, working together. With focus on reducing number of arrests and criminal justice encounters in general, ED visits, hospital admissions, to really focus on the reduction of that criminal justice system utilization, as well as those the highly preventable medical costs that are associated with the ED visits and hospitalizations. And then kind of having that secondary tier of that social determinants of health and the housing stability, and other such quality of life factors as focus.
Yeah, as well as maybe engaging with some lower intensity medical service, things that are needed. So, favoring engagement in primary care, for example, while eliminating, ER visits and so on. But yeah, you captured it well.
All right, noted. Well, thank you so much for your input. Stacy Brubaker, I see your hands up next.
Thank you. I'm having problems with my camera and causing connection, as it always does on Microsoft Teams. So I'm going to leave my camera off. But I agree with everything Dr. Brigham said. And I also would just like to add that I think as we look towards what is potentially a large cut in some of our Medicaid services and the things that the CCOs are going to be able to fund going forward in some of the spaces we've all relied upon, from the social determinants of health to addiction and mental health services, I think that we should look for opportunities to try to not necessarily build out great brand new, but be able to keep whole some of the services we've already put into place. And I'd also love to see that there's some type of a connection if a applicant has a deflection program in their community, to be able to show how they're coordinating so it's not duplicative in any kind of way, just because I think these dollars, although they are quite different in their intent, I think that they certainly support one another, and I would want to make sure that those efforts aren't just separate and running off on their own, rather than figuring out those opportunities for cost savings and coordination to be able to really impact the community and the populations that we're trying to serve. So that's my 2 cents.
Thank you, Stacy. I like the idea of looking for those opportunities to kind of support the existing stuff, especially I can imagine an existing program who had built up so much, hoping to see some of that returned. But then what else is existing in the community, without supplanting funds, of course, but identifying like maybe a real true gap analysis of what services and treatment what needs are in a local jurisdiction. And then it's a great idea to think about asking applicants to really, speak to, hey, is there a deflection program operating in your jurisdiction? And if so, let's not duplicate efforts here. Talk to us about how that, this high utilizer portion of CJC funding is being used versus the deflection funding. Like, how are those programs being collaborative, but are also separate and distinct? Because you're right, the intent for impacts funding is really to go to the high utilizer population, the folks that are using these services at the highest level, and those return customers, cycling in and out through jail and the ED. So they do have some overlap, But I think you're right that it can be separate and distinct, and what a great thing to ask applicants to speak to as part of their application. Do GRC members have any thoughts on the past spending patterns? I know that was something that had been brought up as part of the evaluation efforts ideas. And, you know, is that something that you all have a desire to look into in terms of a previous grantee is applying for new funding? And, you know, does that want to be a consideration?
I'll chime in. This is Stacy. I totally agree that it's, we would certainly want to see what's already been done or what money's already been thrown that way before we decide we're going to just throw more if there's nothing to really show for their efforts. Sorry, I jumped in front of you. I'm sorry.
Go ahead, Sheriff Hunter. Thank you. And thanks, Stacy.
No, I was kind of just sitting in the background because this is day one and I'm sort of jumping into this, and I was more sort of listening than doing anything else. But here we go. Some of you know me already, so I can't keep my mouth shut, so we'll talk. When you talk about past spending patterns, I think it's really important. Is this fiscally responsible where this money is going and where's the money going? The problem with the spending patterns jumps across the aisle there and you get to outcomes. And one of the things that I would like to see is outcomes, but the problem that we are having in the state right now is defining outcomes. And everyone is individually defining what their outcomes, and specifically what they're doing is they're individually defining successes. And we have successes right now that are being defined in a way that I would call it inappropriate, meaning that if you can get someone to a door, but that person doesn't enter that door, that can't be a success. But when we measure that against the sort of the variety of programs, I think in some way, shape, or form, we've got to be able to create a reasonable metric or an analytic that we want to use to then be able to compare against past spending. Because if we don't know where we're going, it's hard to say whether what's been done in the past is right, wrong, or indifferent. And so that's where you get down into program models and how program models are sort of introduced. But at the same time, and I think, Casey, I think you started to kind of hit on it. When you look at those program models, though, it's not just simply what the model is, what is the demographic and what are the challenges that are presented, looking at the difference between rural and urban. I think a lot more input into those, and I haven't seen a lot of the initial programs, but a lot more input into truly defining what the challenges are and what is your intent to work around those challenges, but be able to practically or tangibly show us how you intend to get through some of those hurdles, as opposed to anecdotally, we've got an answer for this. Where's the sort of partner? And there's been a lot of talk about it today, of the collaborations between local health and human services, your community partners, and then law enforcement. If you're going to incorporate law enforcement and it's not coming in there directly, what is your plan to teach law enforcement? What is your plan to communicate with law enforcement? Or it was in a previous slide earlier today, achieve that buy-in. So I think I'm probably going to be the person that wants to see just a whole lot more than a whole lot less in these program submissions. Coming from especially a program that's been around for the last better part of 8 years and the challenges that we've faced. Most folks don't know we started with 2 square blocks. And a lot of people put programs together where they think they're going to solve the world's problems in the next 24 hours. And they're looking at the entirety of their county or a much bigger space than you're going to be able to impact. So trying to, this group should be very good at asking those very realistic and pointed questions about those programs that maybe are not considerations by those that are submitting or the program writers. So some of that back into the program models. I'll stop because I'll probably keep going otherwise, but I think the generality of these questions are good. It's just sort of narrowing down within these broader categories. What are the specific questions that we want to ask as a group so that we can give good feedback to those that are applying and not create ambiguity in the applications because that doesn't benefit anyone.
Thank you, Sheriff Hunter. Yeah, I definitely hear you on the front of, you know, fiscally responsible programs and defining outcomes and definitions of success. You know, they do differ among programs. So really kind of getting to the meat and potatoes, if you will, of what that exactly consists of, and then thinking about fidelity to individual program goals. I think their impacts is so unique in the fact of the flexibility that it provides jurisdictions to operate, you know, in the different ways they do. And so, you know, it would be really interesting to hear from a program, what are your specific and concrete measurable goals? And then for maybe the CJC to measure the fidelity to those goals over the course of the life of the grant. I can imagine too, if that seems like a too big of a bite for this next round, that's something that the CJC can consider as part of the big, you know, 27-29 biennium, the changes that are coming down the way of the specific and measurable goals and outcomes as part of that, you know, the mega grant, if you will. And so I think that these are important conversations to have, even if they are a little bit uncomfortable. And it's stuff that, you know, we definitely want to hear from you and take down in consideration as we begin to build these things. So thank you for your comments. And I think fresh perspective, new perspective is good. So it's okay to be the new kid on the block. Alicia Beamer, I see your hands next.
Oh, yeah, I'm sorry if I'm saying something I had to step off for a minute that has already been said, but I guess a couple things that came to mind, and I actually can recall Judge Shante saying this, so she might have already said it when I was off, but just how will this, as we're soliciting for applications, is there an opportunity to have, especially new county, an opportunity to model off of already existing impacts grant programs that have demonstrated success, so we're not having to reinvent the wheel? And I mean, I think that was part of the goal. I remember when we started this number of years ago, that really the goal was to really identify what are what are the programs that are showing the best outcomes for the populations they're serving that can be replicated throughout the state. So so that we can grow and be efficient and utilize our resources in a more meaningful way. So that would be something that I would suggest we look at. And then also, how do, especially I was just in a meeting this morning talking about the upcoming Medicaid cuts and some of the other program cuts. So I think even the sheriff was talking about just how, as far as cost you know, what are the services that are going to either bridge some of those cuts that are coming up and coming our way, or that are going to reduce the expense of healthcare? For example, emergency department visits are much more expensive. They're, you know, $1,200 to $2,200 a visit versus a crisis stabilization center visit, which is about $400. So that is a great service that reduces cost. It's demonstrated that nationally. And as we're looking at allocating these funds, especially in a time when we're seeing cuts to Medicaid and other services, we do have this funding and this money to be able to just spend and fill some of these gaps that we're going to see in the upcoming years. So thank you.
Thank you, Leisha. And, you know, thank you for your expertise. I think that this is the kind of stuff in terms of like subject matter that we at the CJC really do need input on. I think that I hear you and you know, definitely echo what Judge Shanti has said in the past about identifying kind of the standards, if you will, the what would be the best outcomes and the best models for impacts. What I can share is that we may not be at the point that we're, you know, measured and ready to like make that commitment before opening a solicitation here, but I think we can take the steps in the solicitation to prepare for that, with the first step being identify your program model. Put yourself you know, in a checkbox here of what are you operating and what type of program are you, and then, as you know, Sheriff Hunter said, maybe we measure kind of that fidelity to that, and then for that next version of impacts in 2027, maybe there are models you select from and those are the only operating models for impacts at that time. I, you know, can imagine that there might be a lot of these things that we do need to take in steps, but that doesn't mean that they are too far off or can't be done. And in the meantime, thinking about identifying the services to bridge the gaps in, you know, Medicaid coverage that we know are just right around the corner. And thinking about reducing those really high healthcare costs related to ED visits, especially. Maybe that's a priority that this GRC thinks about making in terms of the solicitation is, you know, the impact program priorities as they stand right now include reducing criminal justice involvement, reducing ED visits and admissions to the Oregon State Hospital. So that's great. And then what's the responsiveness of the applicant to those program priorities? And maybe that's something that the GRC can measure, evaluate, and that's where the competitiveness maybe for the grant funding comes into play.
Yeah, and maybe in the meantime, until maybe it's phone a friend or an expert, a grantee who's run a similar program and get lessons learned, because we have seen these grantees submit, you know, over the years, some amendments or different requests because some things have worked or some things haven't. So I think they could utilize those, you know, their phone the friends and get advice from other grantees in the meantime, especially if they're looking at a similar program or something like it. But I see Judge Shantae's raised her hand, so thank you.
Yeah, thank you, Leisha. I can imagine that those almost kind of like miniature cohorts could be really effective, and something as part of like technical assistance that the CJC could provide of just how simple it is to put your program in touch with other like programs and other experienced individuals. Judge Shanti, thank you for your patience. What do you have to say?
No problem. This is interesting to me. So some of what I have to say probably doesn't apply just to what's going to happen with the new grant solicitations. So some of it might just have to do with the overall program, but I think it's really important that we keep, as you've said, our eye on the ball, which was originally the goal, I thought, was to figure out if there are some best practices that we could scale up. And I heard you say, which I agree with, that right now it might be too early to know what those best practices are for the different models. But I believe, just without being able to point to the specific data points on the reports that we've had over the last couple of years, that we've probably got enough that the people that have been researching this and checking on how things are going can give some advice about, well, here's what we think are the most important practices that are the most successful. And it feels to me like maybe in the solicitation, in working with those folks, this CJC could come up with some of those, saying we want the programs, whatever the different models are, to have these. That would do two things. One is it would help test it. Is that correct? If they all have it, does it improve outcomes? And it would also keep everyone's eye on the ball that the goal is to really reduce recidivism and ER visits and all of that by using practices that work. If we keep creating grant money and people get to reinvent the wheel every time, we're not going to really be making progress. That's why the drug court model works so well, is because it's the most researched model there is, and we know what works and we know what doesn't work. It's not like, let's start a program and think about what we want. So I'm not saying it's all done and we know all of it. I'm just saying there might be a few things that we could incorporate in this solicitation, saying, if you're going to do this kind of model, we want this in it. And of course, that would be in consultation with the people that have been analyzing how successful these programs are. Another thing, which is maybe not having to do with the grant solicitation process, but I think might come in handy in the future, is figuring out on these outcomes. You know, one of the things that people want to know is how much money are we spending and what are we getting back for it? In the report we just had, I saw that there was a footnote about that each program, the grantees, the spending on a grantee ranged from 200,000 to 6 million. So if you read that and you're in the legislature and you're shocked, you're like, what? 200,000 for one person, $6 million for, you know, that's, well, because I've been involved in drug courts, I know that it's the dollar per person isn't the total package, because you have to look at what are you saving had you done nothing. So if, for instance, we know in drug courts that if someone is on a downward departure and they successfully complete the program and they don't recidivate, they have no recidivism for 5 years, and they were on that downward departure, we've saved millions of dollars just by not having them in prison for 5 years. If we are going to look at outcomes, we need to figure out some way of it not just being how much is spent on each grantee, on each person that's being helped, versus how much the program has cost. But these other trackable or analyzable, not anecdotal, and I like the anecdotal stuff, but that's not going to really help to figure out if the program is really working. So I would just suggest that we start looking at that criteria, not just what the recidivism is or the reduction in ER visits, but also the cost. But the cost, not just in what you're spending in the program, but the cost that you're saving. I don't know how much it costs to send someone to the ER that doesn't need to be there, but I'm sure there's data points out there that would tell us, and to wrap that in so that when the legislature or other people are asking, well, how much is this program saving? We're not just talking about the individuals, but how it filters through the whole system. And then finally, all along, and even more with respect to the other program that we were supervising, the deflection program, but impacts too. I've always been concerned with what I see as kind of a disproportionate cost of administration compared to the money that's going to actual services. I don't know, but I'd like to see if you guys could track that or hone in on that, because it feels to me, again, just intuitively after sitting here going through this program for 5 years, it feels to me like sometimes our administrative costs, the money goes more into administration than it does go into services. And I would like to see that change, but I don't know how to change it, but maybe you guys could just consider that, especially that would be important if we could reduce administrative costs when we're going to be losing money on grants and other things that we had to provide the services in the next maybe 4 years or so. Anyway, that's all I had to say. I hope any of it's helpful.
Thank you, Judge Shanti. I definitely hear your concerns with the administrative costs. I think that is something that we could kind of focus in on a little bit more in terms of the grant solicitation, budget proposal, and maybe even think about what's appropriate and set a priority of kind of the proportion for admin costs, perhaps. Those are ideas that are coming to mind right now. And then, gosh, yeah, you've hit the nail on the head. Return on investment, so important. I think that's often the number one question out of a legislator's mouth is what's the bang for the buck here? And it's something, worth considering, and it's difficult to demonstrate. So I appreciate you bringing that up. Cost avoidance is also difficult to demonstrate, but I think you're right. I think that there are things here that we have subject matter experts like in this GRC regards to how much a jail bed might cost in a jurisdiction, how much an ED visit might cost in a jurisdiction. And of course, every jurisdiction is different, but perhaps we can set some sort of average or baseline, or at a minimum, it might cost this when considering cost avoidance and thinking about what that might look like. And then I definitely hear you on, can data and research contribute to kind of these determinations of best practices in the future? And I think you're right. And in the meantime, I like the idea of, you're planning to operate this model. Here are some evidence-informed practices that we've seen in previous impacts programs that we would like you to prioritize as part of operating a model in this way. We don't have, I guess I'm not the researcher here, so Will can probably speak to me, but I don't know if it's evidence-based quite yet, but it can definitely be informed on what we've received in REDCap to date, what we've heard through qualitative analysis and anecdotally, our experience in administering this grant program. We've had some lessons learned, and I think that that's valuable. Sheriff Hunter, I know that your hand popped in there, and I apologize if I segued us if you were trying to reply to Judge Shanti, but I'll hand it over to you next.
No, not specifically. I agree with and appreciate a lot of what the judge is saying. I think my comment actually goes back to Alicia and what she was saying. And I think it's something tangible we could do, in case you just brought it back up. So on those applications, if it is a new application, where is the section on the application that says, who have you previously reached out to? If the CJC's a repository, knows where these programs have previously existed, who have you reached out to and what have you learned that has helped shape this application that you are now bringing forward today? Because similar to what we saw with deflection programs, nobody needs to reinvent the wheel. And there were people all over that were willing to help design, build, lessons learned, all of those things along the way, so that there's no one that should have essentially at this point built a deflection program from the ground up. Yes, in their jurisdiction, they had to do that, but the actual logistics of getting to work and all those pieces, the answers were out there. So I think that's a great question on the new applications. And then the question on those applications that are now going to be new or come in from existing programs. The question is, how has your program developed, change? What programmatic changes have you made? And basically the same thing applies. Have you consulted, talked to, or conferred with other programs out there? I think we do, unfortunately, we do a lot of things in a silo that we don't need to do in a silo. And this is really the question that is put forth that says, what are you doing to break down those silos? I get that Union County is different than Marion County, but there are a lot of things that will cross over, and a lot of lessons that can be learned along the way that are applicable to both. So it wasn't necessarily the judge. It was back to something that Alicia said, and I completely agree. I think that's something we can hold folks accountable to, and you shouldn't just be bringing something to us. What have you done in homework before you brought this to us for evaluation?
Thank you. I appreciate you sharing those comments. And something that we have heard from existing grantees as a desire, a want, is an opportunity to come together, be it at large or in, like programs and similar cohorts, to share those lessons learned. So maybe the CJC can explore that in kind of a technical assistance capacity at a minimum. So I love the idea of including it in the application, and like maybe some continued check-ins or cohort meetings along the way to continue that collaboration and kind of like that peer-to-peer assistance as programs are actually being implemented. Stacy Rubiker, I see your hand's up next. And Judge Shanti, I also see your hand is still raised. Did you have a comment, I guess, before I transition to Stacy?
Oh, I'm sorry. No, I didn't. I'll put it down.
Okay. Stacy, floor is yours.
I just wanted to chime in a little bit about Judge Shanti's comment about administrative cost. I too think we need to be cautious about that, but I also think with that in mind, we need to keep in mind all of the administrative burden that sometimes comes on top of these grants that are sometimes duplicative, time consuming, helpful, not helpful. But when you have to hire staff just simply to be able to do all of the reporting and all of the requirements, it really becomes expensive quickly, especially, we've talked about this before and you know where I stand on all of this, but with OHA, oftentimes we will submit data and then they don't know that we've submitted that data. And so then we have another program or another manager or whoever asking us for the same data when they really could go to themselves, talk amongst themselves to pull the data rather than asking us for us twice. So I just think when we think about OAR creation, what we put in the grant as the reporting obligations, all of those things, that's what adds to the cost of administrative burden. And so if we could just be mindful about what we put in the grant and how many reports we have to do, as well as who they go to, and just that coordination, just from being somebody that's over a lot of these kind of processes, that's really where the challenge comes, is you have to have bodies to do that work. And if we're doing it in multiple different avenues for multiple different things, and they can't take advantage of things that are already available or submitted, or that we could do in a different way to reduce those costs, I think that anything we can offer this or any other grantee to try to cut down on that might help with some of what the perceived costs are of what they have to have for administration. Off my soapbox now. Thank you.
Thank you, Stacy. I appreciate your comments. Yeah, I'm, thinking about how to, have that balance there of being mindful about the admin burden and also the often disproportionate admin costs. And so that's something that I think maybe we can all think on a little bit more over the coming months as we're developing the solicitation. Are there any other thoughts or ideas for the time of being? And also, everyone, I probably should navigate to the next slide. I realize I'm still sharing my screen. But please do know that you can reach out to me via email with other ideas, and same offer extends to you all as it did to Janie Gullickson, who had to leave early. And be sure to follow up with the GRC members who were not able to be in attendance today to seek their input as well. You know, I really intend for this to be a a collaborative effort on my team's behalf in responsive to the feedback that you provided today. And I think that I'm excited to create this next solicitation for the next version of impacts. And yeah, but are there any other thoughts at this time? And I'll go ahead and stop sharing my screen. Okay, well, I think that was a healthy pause. And I think that it looks like no one else has a burning comment they want to make at this moment. So I believe now would probably be a good time to wrap up early and give you back a little bit of your afternoon. Thank you for tuning in today and for providing this input. It's valuable and we appreciate it. And we look forward to the next. So onward. Take care.
Thanks. Great meeting, Casey. Appreciate it.
Appreciate it,
Thank you.
Lisa. Thanks.
Bye.